When we pay you, it's 15% what Medicare would have paid, hence we're saving 15%. Private fee-for-service plans were all the rage when they came out. Why? It's any doctor, anywhere, anytime, as long as the doctor, and here's the key phrase, would agree to the terms and conditions allowed by the plan for reimbursement. What does that mean? We may not pay the same as Medicare. We may pay less, and you as a physician have to agree to it in advance. And if you don't treat our patient. But everybody sort of private fee-for-service plans as the end-all be-all because, hey, I can go anywhere I want. But the doctor has to be willing to accept the terms and conditions of payment. So they're still around, but they're kind of going away. This plan here, which is the one I'm going to focus on tonight, which I think is the plan to go with if you want high quality, you want to be able to see a doctor and so forth. MSA, or Medical Savings Account. This is very uncommon to see. I don't know if anybody's ever seen it. Most people see MA plans, but most people don't see the MSA plan. This MSA design, I actually was talking to a physician about when I started the business almost 20 years ago. Essentially what it is, and we're going to get into the details of it, it's still considered a Medicare Advantage plan, but unlike a PPO where you have a network, unlike an HMO where you have a network, under an MSA you can see any doctor in the country. Any doctor, as long as he's willing to accept the payment from the plan, but he can refuse you if he accepts assignments. MSAs are a little unique in that sense.
Does MSA have in-network and out-of-network?
No network.
No network.
No network in an MSA.
So would the doctor have to accept Medicare?
He has to be a Medicare provider, because an MSA, in the rule book, when you read it, it says exactly this. An MSA pays all the same benefits as original Medicare, just like all Medicare Advantage plans, all the same benefits as original Medicare, but the doctor does not have to accept payment from the MSA. Unlike under these plans where if he's a Medicare provider, has a contract with the network, he has to accept whatever they
I
charge.
got a doctor who wants to charge $500. Plan pays $300. I have to make the $200 difference.
No.
If he accepts it.
But
He accepts it, there's a payment.
If he accepts assignment, then,
and it's okay.
right, because the MSA
If I want to go
reimburses at the Medicare
doesn't
reimbursement.
accept the assignment, would they pay me? or-
No, then you have a cap of 15% over above, but I'm going to get the details of it.
One question, how do you know what doctors accept MSA?
You have to ask your physician, do you accept an MSA? I can tell you that most doctors have probably never heard of an MSA. They say, sure, I'll take it. I mean, I don't know, I can't speak for them, but this plan is not really, I don't want to say popular, you don't hear about it because it's a unique plan. And essentially, here's the way it works.
What makes it so good?
What makes it good? Because unlike in a PPO where you have a network, or an increased cost when you go out of the network, or an HMO where you have a network and you have to stay within the network, the thing that makes this attractive is you can go to any doctor who accepts Medicare. Yes, you can, at a higher out-of-pocket cost. Right. True, yes, but that's why a lot of companies are getting out of PPOs. They control their costs. The reason why you bought the PPO is for exactly why you're saying. I can go to any doctor I want, pay a little bit more.
So 0 rate?
Well, it was, yeah.
No, still it's 2013,
Yeah.
it's still offering.
Yeah. So, I mean, yeah. So the major advantages of a Medicare Advantage plan is going to go back to what you said before was, unlike the 20% on original Medicare, which is unlimited 20%, here they cap you at a stop loss. They give you an out-of-pocket maximum. Usually either 3,400 or you see 3,400, 6,700. You can look in the book, you know, you can look in the law, but you see 3,400 as the most common out-of-pocket maximum. And that's the attractive part of a Medicare Advantage plan. You get all the same benefits as original Medicare, plus possibly additional benefits like vision, hearing, things like that. And they cap you at 3,400 or 6,700, whatever the stop loss is. So Medicare Advantage plans offer a lot of advantages because there's limited liability. And that's really what insurance is all about. How do I mitigate or limit my risk? And that's what a Medicare Advantage plan offers you. Okay, let's go to the next one here. Okay, next one. Yeah, so what I did here is, can you go back up one, Brandon? Go up one more. Okay, so what I did is, this skipped over. What I did is I took 4 of the most common plans, and for me, insurance is mathematics. It's just, that's all it is. It's just how much, because what's the first thing you think about when you're paying insurance? It's your premium. Like, what am I paying for this? What benefit am I getting for it? So it's all mathematics, right? And the mathematics is about how do I limit my risk? You know, what's my risk and what's my out-of-pocket cost in the end? Because in the end, you have original Medicare, you can have really 4 options. You can put it with a supplement to eliminate the deductibles and co-insurance. The supplements are standardized. There's no difference from one carrier to the next. All carriers offer this, can offer all the same benefits. If you choose a plan F under one carrier and another carrier offers a plan F, it's the same exact benefits. The only difference is how much they charge for it. All right? So I took the most common Medicare supplement, which is a plan F. Are you familiar with that plan? Ever hear of it? Okay.
I thought they're not selling them anymore, but if you have one, you can continue to keep it.
No, plan F is being sold. Absolutely is. It's, plan F is probably the most common plan sold because under plan F, it covers all your Part A deductible and co-insurance, so you have 0 exposure on the hospital. It covers all your coverage for Part B, 20%, plus the 15% limiting charge over. So under plan F, as long as you pay your premium, you really have no out-of-pocket costs for deductibles and co-insurance. It's covered at 100% with the supplement. You do have Part D exposure. So what I did is an illustrative purpose. Go ahead, next one. Yeah, I took a premium, which is at the low end of the scale. There's actually a plan F in the marketplace that's a little bit less than this, but I just kind of took this because it was a good number. It really illustrates the point. When you take a supplement with your Medicare Part A and B, the math would work like this. You pay a premium. Premium, by definition, is a known loss. That's the technical term for premium. Premium is a known loss. You pay your premium, you know you're going to lose it to avoid a risk that potentially could happen. Homeowners insurance, you pay a premium. I don't want my house to burn down, but if it does, I'm willing to pay the loss to avoid the more catastrophic event, right? Same thing with medical insurance. Plan F, I pay a premium times 12 months. I'm going to pay $3,600 in that year. I'm going to lose that money to avoid going to the hospital and running up 44 grand on a Part A claim, right? I have to have drug coverage because I don't want to pay a penalty for enrolling late. So I took a common Part D drug plan, standalone, PDP, right? Has to be a PDP. Took that, multiplied it by 12, I came up with that number. I have my Part D deductible, because most of my PDs that you look at have deductible. That's a cost. I entered that. I wanted dental and vision. I want my teeth to rot out of my head. I want to be able to see because I'm getting older. And I can get those plans for about $20 a month. It's another $240. So my total annual cost, when I add it all together, my true out-of-pocket cost, what I'm going to pay to avoid all that risk of Part A, Part B, drug, blah, 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 not including any co-payments for prescription drugs. Like when I go to get a generic drug, I pay $4 for it. Not including that, my true cost is $394.68 roughly. That's what I'm paying to avoid all the risk. That's why we pay insurance. We pay the known loss to avoid the risk. That's a month, yeah. $394 is what it added up to. If you get another type of plan F, it could be a little more, a little less, but that's a good number to work with as far as forecasting your outcome. Yes?
Yeah, does the plan F pay for the donor hole?
Donor hole has nothing to do with your Medicare A and B. That's a Part D benefit, right?
I understand that, but the plan F doesn't cover the Part D
No.
out of pocket? No.
No.
It only covers the A and B.
The A and B exposure is correct, yeah. Anytime you're talking about standalone PDPs, it's a separate, distinct benefit. Deductibles are nothing to do with it. So, first rule of thumb, if I'm going to get a supplement, what's the benefit of a supplement? Any doctor who accepts Medicare, anywhere, anytime, I have total freedom. Price, quality, service, what is it? It's quality and service, I'm paying the price, right? I'm willing to pay for higher quality and better service. That's what a supplement gives you. Now we go to a Medicare Advantage PPO. You have doctors who are in the network who accept a co-payment. So instead of 20%, he's going to do my office visit for 0 or 15, or whatever he's going to do it for. Because he's agreed with the network to do my office visit. As we know, that's what he wants to do now, right? $15 in the network. But I'm in Florida, because I go to Florida 4 months out of the year. Wish. And my network's not there. I'm with ABC Network. You know, up here, they're not down there, so I have to go see a doctor. I'm not a network. I paid 25% co-insurance. I'll see a doctor down there. Next slide. Oh, gee. Plan I chose is $38 a month. Times 12 months, it's $258. My Part D is included, 0 premium. I got my dental and vision, but this particular plan that I chose, I can add it through the plan. It's $30 a month. Another $360. But here's the important thing. My out-of-pocket maximum is $4,500 under this plan. So it's not just so much what I'm paying, but if I had $1 million claim, it's my total exposure. That's what insurance is. How much is my total exposure?
Is that lifetime or
Calendar year. Right. So with claims, in other words, I had $1 million claim because I had bypass surgery, I was in the hospital, my doctor called me up, hey, how you doing? $443 a month is my real monthly exposure for this plan. I have all those benefits similar to the Plan F, but here I have to use the network, or I can go out of network and pay a higher cost. But if I don't have any claims, I just chose that plan. I was healthy all year long, never saw a doctor, didn't do anything. $68 a month. That's attractive, right? Because you can take this, it really works out here like that. But it's the total exposure you have to think about. Total exposure. That's a PPO plan, common one in this Nassau Suffolk area. Here we have an HMO. There are a lot of HMOs. HMOs are proliferating throughout the MAPD business. Why? Because they're predictable. They have controlled environments. So people who set up, or companies who set up Medicare Advantage plans, like to set them up in HMO because they can forecast with certainty what their costs would be. So from an actuarial standpoint, they're attractive. But your perspective, you have to stay within the network unless it's an emergency, right? But if you can find an HMO that will work for you, they are very, very, very attractive. Why? Next slide, please. Because you can find it in this county, you can find an HMO that has a 0 premium. Attractive. It comes with the Part D. It costs you that. Dental and vision's included. Holy mackerel. Preventative only though, not comprehensive. And the out-of-pocket maximum is $3,400. So with claims, my total cost is $283, and without claims, is that right? It's 0. So if I'm in really good health, and I can find an HMO, MAPD, that has doctors that I'm willing to stay with and work within, this is a very attractive option for the economics of it, right? Because if I'm really healthy, I can have a good year and not pay anything for it. Right? Yes, sir.
Just backtrack a second. Dental and vision. You're saying preventative only. What about
Correct.
the other plan?
The other plans are preventative plans too.
They're all preventative.
Right, but you have to buy them standalone. Right. I'm just giving this for illustrative purposes, but dental plans, you could, if you bought
So
a,
you can prevent a catastrophic situation with your teeth. But if your teeth are going to fall out of your head,
right.
you're finished. Basically.
Yeah, preventative is really cleanings, exams,
Exactly.
x-rays. That's what, But if you buy the plan standalone, you're going to pay, $20, $30 a month. But in this particular case, the plan I chose here to kind of illustrate, they give you preventative care, which is cleanings, x-rays, and annual exams. It's just part of it. That's what makes that MAPD more attractive than original Medicare, because they're giving you all the same benefits as original Medicare, plus dental and vision benefits. Okay? So, How do they do it, right? Not to get into the technicalities of it, when you're a Medicare Advantage plan and you join my plan, let's say I'm the plan and you join my plan, Medicare pays me a monthly amount to provide benefits and services to you. I'm at risk for your care, not Medicare. So if let's say they pay me $1,000 a month, which is roughly, I can't tell you exactly the plan, but let's say they pay me $1,000 a month to provide you care, and your care in the month of January was $60. I just made $940 that month. Next month, maybe your care is nothing, and so forth and so on. 1 month you have a heart attack and you're up a $100,000 claim, right? I have stop loss insurance to protect me relative to that as a carrier, right? So I get paid a monthly amount to deliver to you all the same benefits as original Medicare, plus additional things like whatever I want to do, like vision and dental, and it's up to me how I price it. I want to make my plan attractive, so I call it a zero plan premium. You're paying zero, but I'm getting paid from Medicare to provide those services for you. I'm a contracted provider. Got it?
When's the supplement? It's not. Don't take Medicare.
When you join a Medicare Advantage plan, you remain in Medicare. You're always part of Medicare. When you come to a Medicare Advantage plan, that MA plan takes over and delivers services to you. That's why when you have a Medicare Advantage plan, you go to your doctor, you have a Medicare Advantage plan ID card, and you have your Medicare card. You take your Medicare card, you put it in your pocket. You don't show it to them. You show your Medicare Advantage card and say, I'm a member of this plan. If it's an HMO, you're a contracted provider. My office visit is how much? That's what you have to figure out. Like under like this plan, you pay $0 to see a doctor in primary care. The specialist is $25. So let's say I go to the cardiologist, and he called me up and said, hey, how you doing? Yes?
Medicare Advantage plan are good for this year and next year. Are they going to be not available in 2014? And then if they're not available, what happens then? You're back to doing now. If you're not in
Did you guys study before you came? Yes. What she's saying is, are Medicare Advantage plans available this year and next year? And the answer is, right now, they're enrolling Medicare Advantage plans for 2013. So the answer to that question is yes.
But
And if that Medicare Advantage plan, let's say you go to the George Fox Medicare Advantage plan, 2013, you join my plan. And at the end of 2013, I decide, you know what? I don't want to do this anymore. This is just crazy, right? I decide to eliminate my contract with Medicare. I close down. There's a lot of rules. Send you letters, tell you like the people got letters, hey, we're getting out of the business, right? All those rules get followed, and then you have a choice. If there's another Medicare Advantage plan, you can go to that plan, or you can go back to original Medicare. So you never leave the Medicare system. What happens is you transfer who's delivering your care to you under a Medicare Advantage plan. So the important takeaway from that is stay in original Medicare, get a supplement, you stay with original Medicare, and the supplement pays secondary to that. That's the most ancient of ways of doing it, right? Or you go to a Medicare Advantage plan, they take over your care, deliver all your benefits and services, plus additional things that they want to throw at you to make it attractive, and they limit your risk under the plan. Or you get out of the MA plan in the annual enrollment, which is now, and go back to original Medicare. That's your choice. Okay? But here, because it's an HMO, yes.